A patient's condition can change in an instant. One moment they're talking to you and the next, their breathing becomes labored. Perhaps their skin turns a pale, clammy gray. These subtle shifts are more than just numbers on a chart. They are a human being's cry for help. As nurses, we are the sentinels of the hospital floor. We are the ones who see the patients most often, who learn the rhythm of their coughs and the nuances of their smiles. This constant observation allows us to notice when something feels off, even before alarms start blaring. Maybe Mrs. Jones, who was alert and chatty an hour ago, is now unusually quiet, her gaze vacant. Or perhaps Mr. Smith, recovering well from surgery, suddenly becomes agitated and confused. These subtle changes, often dismissed as insignificant, can be the first whispers of a brewing storm. Recognizing these early warning signs is crucial. It's the difference between putting out a small fire and battling a raging inferno. Our ability to act quickly and decisively in these moments can be the difference between life and death for our patients. The urge to panic when a patient's condition deteriorates is understandable. Your heart races, your mind floods with what-ifs, but clarity is paramount. Remember your training. You're not alone. The first step is always to assess the situation. Check their airway. Is it open? Are they breathing? Feel for a pulse. Is it strong and regular? Simultaneously, call for help. Don't hesitate. Even if you're unsure, it's better to err on the side of caution. While waiting for assistance, continue to monitor the patient closely. Note their vital signs, heart rate, blood pressure, respiratory rate, and oxygen saturation. If possible, start basic life support measures, like administering oxygen or assisting with breathing. Remember, your initial actions can stabilize the patient and buy precious time for the medical team to arrive. Every second counts, and your swift, decisive actions can make all the difference. When a patient crashes, the hospital floor transforms into a carefully choreographed dance of controlled chaos. Nurses, doctors, respiratory therapists, and pharmacists work together with a shared sense of urgency and purpose. Clear, concise communication is the backbone of this intricate dance. When reporting a patient's deterioration, use the SBAR format: situation, background, assessment, recommendation. This ensures that everyone receives the same critical information in a structured and timely manner. Teamwork extends beyond just verbal communication. It's about anticipating needs, offering support, and trusting in each other's expertise. The nurse who notices the subtle change in a patient's breathing, the doctor who makes the critical diagnosis, the respiratory therapist who expertly manages the airway. Each member of the team plays a crucial role in the symphony of saving a life. Responding effectively to acute clinical deterioration isn't just about knowing what to do, it's about being prepared to act when the moment arises. This means regularly reviewing protocols, practicing skills like CPR and airway management, and participating in simulation labs. These simulations, while artificial, provide invaluable opportunities to hone our skills in a safe environment. They allow us to experience the adrenaline rush of a real-life crisis, to practice teamwork and communication under pressure, and to refine our responses to better serve our patients. In the high-stakes world of healthcare, there is no room for complacency. We must be vigilant, prepared, and ready to respond at a moment's notice. Because when a patient's life hangs in the balance, every second counts, and our actions can make the difference between tragedy and triumph.